group that was told to eat more fruit had a BMI about 6 points higher and significantly worse a number of different health parameters.
Yep.
But if I'm looking at myself, that would be the equivalent of myself putting on about 40 pounds in 6 months just from eating extra fruit. Another study was fruit makes you and your liver fat. That wasn't the headline. I believe it was something along the lines of dietary fruit intake effect on liver biomarkers. And these were patients with known NAFLD, non-alcoholic fatty liver disease. So it's fairly well known that excess fructose is going to make a sick liver sicker. I think that kind of goes without saying.
Yep.
And this kind of goes back to what we were talking about earlier, when it's really important to look at the methods and materials and were things properly randomized, which we don't have access to because this article is behind a paywall, but we do have the outcomes data. So the experiment seems very simple. You have one group of NAFLD patients told eat less than 2 servings of fruit per day. You have another group that's told eat 4 servings of fruit per day. And at the end of the trial, which I believe was 6 months, I may be misspeaking there, but the group that was told to eat more fruit had a BMI about 6 points higher and significantly worse a number of different health parameters.
Yep.
But if I'm looking at myself, that would be the equivalent of myself putting on about 40 pounds in 6 months just from eating extra fruit. So I crunched the numbers on this. I was like, well, what if I just added 4 extra bananas a day to my current diet? And I assumed that my metabolic rate did not increase whatsoever. That would still only be enough calories for about 20 pounds.
So 8 bananas per day.
Assuming that your metabolic rate doesn't increase with the weight whatsoever. So it'd probably be closer to 10 or 12 extra bananas per day.
Yep. That seems like a lot of bananas.
Yeah, you could say it's bananas.
Yeah.
But I don't think that your general healthy population needs to restrict their fruit intake.
No.
Someone who has either alcoholic or non-alcoholic fatty liver disease probably needs to take a look more at either the alcohol that caused it or high fructose corn syrup before they go about limiting fruits.
For sure.
But in someone who is trying to pull all of the levers and cross off every variable they can in terms of reducing that disease state of fatty liver, cutting out fructose for a period of time until the liver is restored to a state of health might make some sense. I mean, you're certainly not going to, I could argue you're certainly not going to have a detriment if you're eating, let's say, 5 or 6 servings of vegetables as opposed to 2 servings of vegetables and 3 servings of fruits. Fruits just tend to taste better.
A more interesting study to me would be, instead of eat less than 2 or 3 to 4, whatever they told them, if they took one group and told them eat the fruits that have really advantageous, healthy fiber to carb ratios, and then the other group told them to eat the fruits that had very disadvantageous fiber to carb ratios, or perhaps track the 2 groups, and you have the limitation of self-reporting. But to me, that would be more clinically applicable. However, I'm going to tell patients to eat the fruits with more fiber anyway. So perhaps that's even not that interesting of a study.
Give one arm of the study 4 servings of wild blueberries per day.
Yes.
Great fiber source. And the other arm, 4 servings of dried dates with an incredibly high sugar and fructose content.
I bet those would be 2 very different groups, wouldn't they?
Yeah, and dates are delicious. I don't tend to consume them a lot. Wild blueberries, something that I do consume quite regularly, typically about a cup per day.
Yeah. Dried dates are essentially a natural sugar alternative. And if you doubt this, then you can reduce them down into date syrup. Then it is almost indiscernible from like molasses or liquid, or just you can use it as syrup for pancakes. It's a sugar.
Interesting.
Yep.
Yeah. So just because something is natural, if you process it down to such a high degree, it can be indiscernible from added sugar that is in many things and probably carries the same health risks in excess.
It's paleo though. So having 100 grams of sugar from date syrup is a great thing on a paleo diet.
Probably what the cavemen were doing.
Yeah, have it with your anabolic French toast for your caveman diet.
We're gonna have the carnivores, paleos, and vegans all after us at some point.
Yeah, probably so. Now the paleos.
Lucky for us, the vast majority of people are omnivores.
Yeah, I eat mostly paleo for the record, but most people are still omnivores. It's interesting to see. Here's another study that may exist but probably doesn't. See the concordance with individuals switching between an extreme diet, for example, an Ornish diet or a vegan diet, or which are kind of similar, or paleo diet or a carnivore diet, versus like small tweaks to the diet. I bet there's individuals that like to switch between the extreme.
And perhaps certain people switching to that extreme helps them with compliance. If they specifically are setting limits, which we know is a powerful behavioral tool.
Yep.
It's a very strict limit, such as only animal products, or
Correct.
eliminating meat products, which is eliminate essentially almost all of the saturated fat from your diet, unless you're drinking like coconut butter or something, coconut oil. I think it could have a higher success rate in terms of adherence to the diet. Not that it's a superior diet, but just as far as individuals' psychology and willpower and what works for some people, maybe moderation, other people, maybe not.
The best diet is obviously not a diet at all. It's a habit or habitual eating that you can adhere to.
Yeah, really a lifestyle, and just building out the same patterns and repetition reinforces those things.